Hello, and thanks for joining us. Welcome to the 2021 American Diabetes Association Ask the Expert series. Today's topic is preventing sight loss. What is in your toolbox? My name is Carla Cox, registered dietitian and certified diabetes care and education specialist, and your host for today's program. I am presenting this from the airport, so you may hear a little background noise, and I apologize for that.
17, and you got off the aircraft and you...
Remember that our Ask the Expert series is all about answering questions from our listeners. So start getting your questions ready. Remember, today's topic is preventing sight loss. What is in your toolbox? For those of you on the phone, press *3, that's *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Stay with us through the hour, and we will send you useful resources to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit about why we're here. The American Diabetes Association, together with visionary partners, VSP Vision Care, and Regeneron Pharmaceuticals Incorporated, is focusing on an often overlooked but costly, devastating complication of diabetes, vision loss. This eye health initiative, focused on diabetes, provides tools and resources for people with diabetes to learn how to reduce their risk of developing eye disease by managing glucose values and getting an annual comprehensive dilated eye exam, even if symptoms are not present. As part of the initiative, the ADA is holding this free educational Q&A. We'll cover information and tips to help you take charge of your health. The health and safety of all those we serve at the American Diabetes Association is always our top priority. The CDC has determined that COVID-19 is a serious public health threat. In general, people with diabetes face greater risks of complications when dealing with viral infections, and that is true of COVID-19. We encourage persons with diabetes to get vaccinated. If you have questions about the vaccination, please talk with your healthcare provider. The ADA encourages people with diabetes to follow the guidance of the CDC and to contact your medical provider if you suspect you are showing symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus. or call 1-800-DIABETES. That is 1-800-342-2383. And now I am delighted to introduce our guest for today's event, Dr. Julia Howler. Dr. Howler is an ophthalmologist-in-chief at Wills Eye Hospital, a trailblazing retina surgeon and scientist, and a leader who has innovated translational advances against blindness on many fronts. She is a consultant at the Children's Hospital of Philadelphia, one of the world's most renowned retinal surgeons. Dr. Howler has published over 400 scientific articles and book chapters with research interests in retinal pharmacology, macular surgery, venous occlusive disease, diabetic retinopathy, age-related macular degeneration, complicated retinal detachments, and healthcare disparities. And I also have to add that when talking with Dr. Howler earlier, she is delighted to help with anything she can do to help prevent blindness in our patients with diabetes. Dr. Howler, why don't you tell us a little bit more about yourself?
Thanks so much. It's really great to be here. Carla, thanks for the lovely introduction. And it's absolutely true that I spend my life trying to preserve vision and augment vision. And I am at your service if you have any retinal issues, and I'd love to help with any eye issues in general. I'm here at the Wills Eye Hospital in Philadelphia. I have the honor of serving as the ophthalmologist-in-chief. Wills is the oldest and first eye-only hospital in the country. We also had we were the first place to train ophthalmologists as a subspecialty of medicine, so we have the honor of having trained the most ophthalmologists of any place in the country. And it's a noble tradition, but we've got lots of challenges, and so we're very busy every day with research, education, and clinical care. And I'd be happy to help any of you who want to come here if you have visual challenges.
Thank you so much, Dr. Howler. As we're waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. If you were going to provide one tip for reducing the risk of developing eye disease, what would that be?
Well, the best tip for reducing the development of eye disease would be to keep your hemoglobin A1C low. Keep your diabetic control good. Try to keep your blood sugar down so that your hemoglobin A1C number is below 7. That's by far the number one thing that is most useful, other than probably, there are people who are genetically resistant, but unfortunately none of us can really change our genes. I know I've tried, but it hasn't worked. So that would be the number one clue. Now, diabetes, of course, affects the eye at a higher rate than any other organ. So the eye is very vulnerable to diabetes, and after 10 or 20 years of diabetes, almost everybody has some changes in the retinal blood vessels, and those can lead to visual issues as well. So it's nobody's fault if they develop eye disease. It's something that happens to everyone. But the number one best thing you can do to delay that or minimize it is keep your diabetes under good control.
Thank you, Dr. Howler. Now let's take our first question. Mitchell from Long Island, New York, you're live.
Good afternoon, doctor. Thank you for taking the call. I've had diabetes that's been under very good control for the last 38 years. My hemoglobin A1C is usually in the mid to low 6s. Because of insurance changes, they've recently changed my eye doctor. And the eye doctor I went to recently said they weren't able to do refraction at that time because of employment problems in her practice. I don't believe I've ever had a refraction exam. I've had retinal scans and tend to usually go to an eye doctor twice a year. Is that something that I should have, a refraction, or is that something that's only necessary if you have visual active problems?
Thanks for your call, Mitchell. And I was just out on Long Island a few weeks ago, and it was wonderful out there. And good for you. 38 years, low 6s with your hemoglobin A1C. That's fantastic. In answer to your question, refraction means checking for glasses. So often when you come in for dilated exams and other testing with a lot of light in your eye, they don't do the refraction at the same time. But the refraction just means testing you for glasses for distance and near vision. So somebody who is over age 40 usually needs separate glasses for reading and distance, and that would be what the refraction is. So it's not necessary as long as you're seeing well.
Thank you. Our next question comes from Gail in Salem, North Carolina. Gail, you are live.
Am I live now? All right. So January 1st, I woke up and had vision loss in my right eye. I could look like I was looking through a veil, somewhat heavy at parts and somewhat that I could see through my fingers, about that. I went to my regular eye doctor connected to Baptist Hospital, was referred to them. I've seen them 2 times, had machines examined various vision and depth and stuff like that, pictures. I also had an MRI. There's nothing else. I would say I'm not diagnosed with having diabetes, but like a pre-diabetes, if there is such a thing. But my A1C is like a 6.4, around that age, around that scope. Nobody mentioned diabetes to me when I was having all this meeting with doctors. But since this was coming on today, I thought I would ask that question. Would diabetes be connected with this in any way? They did tell me it was a head.
Well, thanks so much, Gail, and I know exactly where Salem, North Carolina is, and I have a nephew who works down at in the Baptist Health System, so I've got lots of connections. It sounds like in January you developed possibly a little bit of bleeding, a little hemorrhage associated with the vitreous gel pulling away from the retina in that eye. If you are diabetic, you can bleed a lot more when that happens, and sometimes you actually will need surgery to remove the blood. Sometimes you need laser or injections. If things have cleared up gradually, though, then you would not need any of those. It sounds like you don't have diabetes, although you do. I mean, many of us need to worry about prediabetes as we get older, and that's something they'll have to stay on top of. So it can be associated with diabetes, but it doesn't have to be. And in your case, it sounds like probably it was not. So thank you for the call.
Jane from Georgia, you're on the line.
Yes, thank you for taking the call. I had to have cataract surgery on both eyes, and my doctor is keeping an eye on me for glaucoma, which runs in my family, unfortunately. But I was wondering about eye drops, the over-the-counter eye drops that I could possibly use, because my insurance is not covering the prescription my doctor gave me. So what would you recommend? Thank you.
Hi, Jane. Thanks for your question, and I hope your cataract surgery went really well. Cataracts are just the clouding of the lens of the eye, which happens in all of us as we get older. So all of us, if we live long enough, eventually need cataract surgery. Glaucoma is one of the most serious problems that can affect us, and it does tend to run in families, and that's one of the things that we check for routinely when you have an eye exam. I'm not sure what the eye drops are for, and it depends a little bit on their purpose in terms of getting something over the counter. If they are for dry eyes, in other words, they're for supplementing your tears because you have a little bit of a low tear film, you certainly can get those over the counter, and those there are many brands, because almost all of us need some artificial tear supplementation at some point in our lives, and often under certain conditions where it's kind of dry. And some of the types of very common, often used over-the-counter drops would include Cystane, Refresh, Tears, Tears Plus, and those are widely available. If the drops are for glaucoma, to lower the pressure in the eye so that you don't have glaucoma damage, there are no over-the-counter drops for that. So you'd have to pursue some other type of strategy for getting those, and perhaps your doctor could find, an older brand of glaucoma drops that the patent had worn off and they had gone generic, and if those would work for you, then even though they might not be his first line choice, if it makes a difference if they work, so what, and they're cheaper, then I would switch to those. So you'll have to circle back and find out what the drops are for. Thank you.
Thank you. I want to go now to Jonah. Jonah from Berkeley, California. You're on.
Hi. My question, I'm cerebral palsy with legal blindness. I have developed diabetes 2 recently, but it's well controlled. I'm curious as to whether there are researchers, because I'm already legally blind, whether there are researchers into how to keep diabetes from increasing the blindness further. All right, I'm part of the Lions Vision Resource Network in the Bay Area, so I feel I have to ask this question. It's my blindness hasn't gotten any worse, but is there research into different devices to keep the diabetes away from the blindness?
Yes. Yeah, so thank you for that question. That sets me up perfectly to talk about one of my favorite topics, which is research in diabetic retinopathy. And the answer is there's tons of research going on. And as you very correctly focus in on, preventing things from going downhill is crucial, because once the cow is out of the barn, there's often not much we can do. And that's why when you have diabetes, a yearly eye exam is so crucial, because we can catch things just as they're starting and prevent exactly what you're talking about, prevent any loss of vision. So there are a number of different strategies for preventing the loss of vision. Those can include laser treatments. Those can include different types of drugs that can be injected in and around the eye. And increasingly, there are more and more non-invasive, safer, easier, quicker ways to take care of the eyes, so that even though they're having some impact from diabetes, you do not lose vision. It turns out that 98% or so of visual loss due to diabetes is entirely preventable, and that's why it's so agonizing for those of us who are in the field to know that in this day and age, the number one cause of blindness in working-age Americans is diabetic retinopathy. When it's preventable. That's just agonizing. So I would encourage you to see, you happen to be in the Bay Area, which has some of the best medicine in the world. Of course, some of the big institutions there include UCSF, which has a wonderful eye department. Stanford, down the peninsula a bit, has a wonderful eye department. And there are many great ophthalmologists in general practice in and around Berkeley. So there should be plenty of people who can take a look at your eye once a year and just make sure that you don't need any of these drugs. And should you need something, you can rest assured that in just a few years we're going to have better therapies than we do today, and that's because of all the research that's going on. Very hot area. Thanks for asking that.
Thank you. That's very encouraging. If you're just joining us, welcome to today's Ask the Expert Q&A, Prevent Sight Loss, What's in Your Toolbox. Once again, sorry for the background noise. I'm at the airport bringing this to you. As a reminder, for those of you on the phone, press *3 on your keypad, and an operator will collect your question. That's *3, and place you in a queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player, and press the Submit Question button, and your question will come directly to us. Okay, we're going to go to Carolyn in Woodbridge.
Hi. I've had black spots occasionally, a couple of days, and they go away. I wondered, does that mean something that I should have checked out?
Thanks, Carolyn. I'm assuming you're diabetic, and you should have it checked out, because when you see new spots and you've had diabetes for a number of years, it can be blood that you're seeing in the eyes, and you want to make sure that nothing needs to be done in terms of treatment. Now, if you're not diabetic, it still should be checked out, because there could be other things going on. So any new acute symptom that is blocking your vision, floaters, new spots in front of the eye, should definitely be checked out. Thank you.
Thank you. We now have a question from Sue from Kimmerer, Wyoming. Sue, you're on the line.
Yes, I was wondering, if you are a diabetic like I am myself, how many times a year do you need to get your eyes checked?
Thank you so much. Wyoming, wow. What a great occasion this is. Everybody's listening in from all over the country. I'm very honored. The answer to that is, Sue, that if you are diabetic, you should get your eyes checked once a year. Now, if the diabetic eye disease turns out to be something of concern that needs treatment, you may well end up seeing the eye doctor more frequently, but the baseline would be a yearly checkup. Thank you.
Okay, this question comes in online. It's from Anne. I work on a computer 8 hours a day when I know it's hard on my eyes, even healthy people. Are there any special concerns or tips for someone who had type 1 diabetes for nearly 20 years to avoid additional exacerbated damage by watching the computer so much?
Mm-hmm. You know, that's such an excellent question, and because the pandemic has brought out all sorts of new issues because everybody has been on their screen day in, day out. And the good news is that it does not do any permanent damage to the eye. So even if you did have some diabetic retinopathy, it would not be injuring your eye to use it. Now, it can cause headaches and eye strain. A lot of people are getting problems with dry eyes and find they need to have a little bottle of artificial tears by their computer that they pop in. I know I have one next to my computer just because, interestingly, many of us, when we are looking at screens or through microscopes, we don't blink as much and our eyes can dry out quite a bit. So artificial tears would be something to think about. We also recommend that after you've been watching the screen for a while, so every 20 minutes or half hour or so, that you look away. A good rule is if you've been staring at the screen for 20 minutes, look away for 20 seconds, look in the distance, look around, see if you can help your eyes take a little break, almost like standing up and walking around the room would be for your legs and your body, and see if you can prevent the eye strain. Now, we are also finding that many people are needing some reading glasses for their computer screen. They just get tired. Some people find that they have to adjust the background intensity. Many people are putting on the blue filter so they can go to sleep at night because they're on the computer so much that it's keeping them up. So there are a lot of adjustments like that that can make your experience better and easier and less attended by fatigue, eye strain, headaches, things like that. But it's comforting, I think, to know that at least it doesn't do permanent damage to the eye. Thank you.
Thank you very much. So we're going to go to Maney from Portland.
Hello. Thank you for taking my call. I am 88 years old, and I am a type 2 diabetic with glaucoma. Recently, the doctor said I was legally blind. He has me on Timolol and fish oil, and, of course, I use artificial tears. But for the last year and a half, I have been staying inside the retirement home where I live, and I have not been out, but my vision has gotten progressively worse. So I don't know. I've done some reading, and it says that glaucoma is irreversible. When I go into the bathroom, I have a wall-to-wall mirror. I can no longer see myself, and in the dining room in the retirement home, I can't see the furniture. So my question is also, I am seeing things now when I'm sitting in my chair that aren't there. I'm not asleep. I'm wide awake. Is there anything I can do to help myself, or any question I should ask the doctor? I'll be going in 2 weeks.
Wow. Well, that's very scary, and I'm just so sorry to hear you're having all these troubles. God bless you. 88 years old, and going so strong mentally, obviously. I'm concerned as to why things are getting worse. I think it is important to see your doctor in the next week or two and get a read on what's going on. If you don't feel like you're getting a good read, and you'd just like to have a second opinion, I encourage anyone when things are not going well to consider a second opinion. You happen to have there in Portland at the University of Oregon one of the finest eye departments in the country, and I would have absolutely no hesitation. I know the people there, and you can tell them I recommended you. I would go see one of the glaucoma specialists and retina specialists there if you're not already seeing them, or if you feel like your vision is going down and you're not getting the answers that you need, because these are treatable diseases. Glaucoma and diabetic retinopathy are treatable diseases, and they need to be at least halted in their tracks, even if they can't regain you any vision. And then the other thing I would suggest is that they set you up with a low vision consultant to see how the vision that you do have can be maximized in any way possible, with special technology or special glasses or computer software or other things that can help you make the most of the vision that you do have. And that takes a specialist, and they should be able to help you with that. Good luck.
Thank you. Just a reminder to everyone calling in and writing in, the topic today is on eye disease. We have a wonderful ophthalmologist with us to discuss that. Also, at the conclusion of the Q&A segment, you are welcome to stay on the phone or online to complete a short 5-question survey. Your feedback is important to us and will help us for future planning. You've been asking great questions. We hope you will participate in the closing survey. Okay, so let's go to Carol. Carol in Baltimore, you are on the line.
Hi, thanks for taking my call. A couple things. I was wondering, for when you say an eye checkup every year, does that include like a dilation of the eye, checking eye pressure and all that stuff, or is that just something that is depending on what they see? Does that make sense? Am I making sense?
Yes, you are making sense, absolute sense. And I'm so glad you asked that question because I might not have been clear earlier. It's important to have a dilated eye exam. What does dilated mean? Dilated means we put drops in the eye and dilate the pupil so that we can see into the back of the eye and see the retina. The retina is the part of the eye number one most impacted by diabetes, particularly the retinal blood vessels, and the retina lines the back of your eye. So to really see the retina, we have to put dilating drops in and dilate you up. So when I say an annual eye exam, I don't just mean going in and seeing somebody to see if your glasses need to be tuned up. No. We are talking about a full-fledged examination with an ophthalmologist where they dilate up your pupil and take a look. Thanks for asking that.
Okay, thank you. So now I'm going to ask for Parveen. Parveen from Florida. You're online.
Hello? Hello?
Yes, you're on the line, Parveen.
Yes, I am from California. Yes, I was a little confused. Yes, I have been diabetic almost 33 years, and my blood sugar is always, A1C is always 7 or 7.1, like that. But my floater is staying there almost more than 20 years. And now I have cataract. My doctor told me that I have to do my cataract surgery within 1.5 years. And because of coronavirus, it's already 1.5 years has gone. Now, no doctor is giving me the appointment. They say I have to wait. I just would like to know, is it too dangerous that my cataract if I don't do the surgery right now?
Thanks for that question, Parveen. So, and the answer is no, it's not. It's not dangerous. In almost all cases, cataracts are elective surgical procedures, and they can be done at your convenience. The reason to do the cataract surgery is because the lens of your eye, and eyes have lenses just the way cameras have lenses, the lens of your eye has aged, and as our lenses age, they get more opaque and more yellow and cloudier, and it's harder for us to see through them and harder for us to see colors. And so when we get enough of a cataract so that we can't see as well as we need to see, that is when cataract surgery is indicated. So if there's not a change in vision, then you don't need cataract surgery. Even when the vision starts to drop, the cataract is just getting denser and denser. It's not causing, in most cases, an emergency problem. And so it can be put off. If you need help with finding someone to do cataract surgery, I would encourage that you to think about going to one of the many fine academic centers associated with medical schools and universities in California. There are many. Those are all currently performing cataract surgery to the best of my knowledge, and there should be no problem getting you in there, and I'd be happy to help facilitate that if you have trouble on your own.
Thank you. Okay, we're going to go to Adrian from Pensacola. Adrian, you are live.
Yes, good afternoon. My question is, what foods can we eat or supplements that we can take to keep our vision healthy?
Good question. I'm suspicious that someone has planted questions in the audience today because they're all such good questions. So for the eye, particularly the diabetic eye, anything that is a food that is heart healthy is in general also eye healthy. So what do I mean by that? I mean green leafy vegetables, colored vegetables, fruits. So fruits and vegetables, particularly if they're not processed, and if they're served up pretty much on their own, without a lot of creamy, buttery sauces and things, those are very healthy. Also, going light on the red meat and concentrating for any protein that you need on non-red meat substances like fish, particularly the salmon and tuna types of fish, which have a lot of omega acids, fatty acids. Those are the type of dietary recommendations that we make. And if anybody asks me, I say, think of what's heart healthy, and if it's heart healthy, then it is also eye healthy. In terms of supplements, if you're eating a good, healthy diet, you probably don't need any, but some people, for one reason or another, can't eat a healthy diet. A Centrum Silver type of multivitamin, I'm just suggesting that because that's a very commonly used multivitamin, is a good supplement because it has a lot of basic substances in it that are good. Otherwise, we don't recommend vitamin supplementation for the eye, except in the case of macular degeneration. So if you happen to have macular degeneration that is relatively severe, then intermediate to severe, then we do recommend some antioxidant supplementations. But that's the only proven supplement that is of value for eyes.
Thank you. And as a dietitian, I am delighted at your comments. Eating a healthy diet is a big deal, and we need to do it anyway, regardless of any condition we have. So thank you so much for suggesting that. Okay, I want to go to Walter. Walter from Oakland, you are on the line.
Yes, can you hear me?
Yes.
Okay, I have a question. I have diabetes. I'm type 2. My last A1C rating was 5.9. I have glaucoma. I get checked every 4 months by the doctor. I'm having a problem with my right eye, and I don't believe the doctor knows exactly what is wrong. Is it pretty straightforward to determine if an eye problem is being caused by diabetes or something else?
Thank you for that question, Walter. It's as with other questions, it's one of those it depends answers. Some things are relatively straightforward, but some things are a little bit more complicated. And if there is a decrease in vision and your own physician doesn't seem to be addressing it adequately or is stumped, I would ask for a second opinion. And you may be seeing a very good general ophthalmologist, but it might be advantageous to see a specialist, particularly, your eyes are your eyes, right? And so much of our quality of life depends on our having good vision. So I am worried about that right eye, particularly since you are at risk both for diabetic eye disease and, of course, as you mentioned, you have the glaucoma. They're seeing you every 4 months, which is good. That suggests to me that they're trying to stay on top of this. But I would say that if you feel that things are not to your liking, you can ask your doctor for a recommendation for a second opinion, or you could seek out one of the very good university medical school associated ophthalmology departments that would have top academic people, I suspect, and you can do your own research too for really top flight specialists. And I would definitely do that if you don't feel like you're getting the answers that you really need. Thank you.
Thank you. We're going to go to Bharati Shah from Houston, and this is a type 1 question.
Hello.
Hello, you're on the line.
Yes, I am. Thank you for answering. Oh, okay. I have a grandchildren is about 5 years old and is diabetes 1. So when did he supposed to do the eye check?
So thank you for the question. My husband did his training down at Baylor in Houston, so we have very fond feelings towards Houston as a city. Eye checks. Diabetics should have an eye check every year, and by an eye check we mean a dilated eye exam where the retina is examined. That should be an annual thing you put on your calendar with a reminder because it's very important. Thank you.
This is an interesting question. This is coming from George in Philadelphia. George, you are on the line.
Yes. Thank you for taking the question. My question is, I'm a diabetic, a type 2 diabetic, and I've been a diabetic all my life I think I inherited it from my parents. Now, I go and see the doctor about the diabetic. Now, I went to see an eye doctor, and he prescribed some glasses for me. So we got the glasses. And with the glasses, I don't see any better. I don't do any better. Then he sent me to a specialist. And with the specialist, he stuck me in the eye twice, 2 visits with him. And he stuck me in the eye with some kind of injection. So now I still see, but I can't see far, and it's blurry. And what am I to do?
Thank you, George. Well, it sounds like your decreased vision is due to diabetic retinopathy, because diabetic retinopathy is treated with either laser or injections into the eye. And it sounds like they discovered that your blurry vision was due to blood vessel leakage that needs to be treated with these incredible drugs that were invented now about 20 years ago, which have totally changed our ability to get on top of diabetic eye disease. Typically, it takes a number of injections stretched out over many years, so that is a difficult part of the treatment, but I would encourage you to stick with it. If you would like a second opinion, you're in Philadelphia, we'd be happy to see you here at Wills Eye Hospital and take a look at you. So let me know if we can help with that. But it sounds as if you had the decrease in vision, you were right on top of it, you got it checked by your eye doctor, and they sent you to a retina specialist who is now correctly treating you for the diabetic retinopathy, and I'm hopeful that they're going to be able to hold on to and restore really good vision for you. Thank you.
Great answer. Thank you. So we're going to go to Sharon in Louisville. Sharon, you are live. Sharon?
Hello, can you hear me?
We can. Thank you.
Oh, hi. Okay, so I was very recently diagnosed with type 2 diabetes, and I was put on metformin, and I have noticed for about the last month that my vision seems blurry, but I do have dry eye, and they suspect I might have Sjogren's because I also have some other autoimmune diseases. Do you think that the blurry vision might be caused by the metformin, or is that part of the diabetes? Now that I'm hearing all this stuff about retinopathy, which I didn't know about before this seminar, I'm kind of getting worried.
Well, thanks for the question, and it's a really important point. It could be caused by either or even other issues. So diabetes itself can make the vision blurry as your blood sugar goes up. The lens of the eye can swell, which can blur you, and then sometimes if your blood sugar then plunges down, the lens will stop swelling, and then your vision changes. So there can be a lot of visual changes are one of the symptoms of diabetes. Sometimes how we diagnose it. The metformin could have changed your blood sugar level, which may have thrown off something in the eye. Metformin can occasionally contribute to swelling in the retina, so that needs to be checked out. Or there could be something completely different going on, or it could be that your eyes have just changed with age and you need glasses. So hopefully it's something that is very easily fixable, but you definitely need to see a good eye doctor. Go to you need to see a good ophthalmologist who can check out and figure out which of all these different possibilities, what's going on, and make a good diagnosis and then help you.
Thank you. Sometimes when patients come in, they'll say, I don't see any reason why I have to go get a dilated eye exam because I see beautifully. Could you kind of explain why that annual exam is so important?
Yes, and that is a common misunderstanding because people think if I'm seeing fine, my eye must be fine. But like a lot of diseases where you can actually feel pretty well up until something goes wrong, the diabetic retinopathy can be sneaking up on you, and it can be very silent and sneak up, and you can be developing abnormal blood vessels, and you feel like everything is fine until, boom, they bleed, and then your eye's full of blood and you can't see anything. So you can go from seeing 20/20 to not being able to see your hand in front of your face. And all of that could have been prevented if it had been caught early. So it's just like, high blood pressure, for example. People feel perfectly fine. They don't know they have high blood pressure, and then one day they have a stroke. It's a lot depends on early diagnosis and treatment, and diabetes can silently rob you of your vision, and you don't even know it. So you need the help of eye care professionals.
Thank you. We have a number of questions here. I'm going to read to you the first one on surgery. So this comes from Linda in California.
Hello?
Linda, are you with us?
Oh, yes, I am. Thank you for taking my call. I've been diabetic for quite some time, and a lot of times my A1Cs are high. We're working on getting them low and doing fairly okay. The last time I seen the eye doctor, he did say that he saw some retinopathy in there, but I also have cataracts. He hasn't treated the retinopathy. It was like, come back. I pushed the appointment up earlier, and so I have one today. Is it okay to have the cataract surgery with the retinopathy present?
Thank you for that question. The answer is yes. Yes, it is. But in general, we like to get the retinopathy under control before going into a surgical procedure of any type on the eye, including cataract operation. So, it kind of makes sense. Just as you'd like to get your blood pressure and your heart and any other issues under control before you had any type of surgery on your body, if it's your eye, if you've got biologically active diabetic eye disease, you want to stop that in its tracks before you think of something like an eye operation, and that can readily be done, but it just it takes partnership. I'm a retina specialist, so I end up partnering a lot with my cataract surgery colleagues, and very often we're collaborating closely as we're trying to get the patient ready for cataract surgery with the retinal situation under excellent control before they decide to take that step. So thank you.
And here's another question on surgery. This is coming from Richard from Illinois. Richard, you're online.
I'm having surgery next week on my retina, my right eye. It's said to be too tight. They want to make an incision and put a bubble in my right eye. Is diabetes going to affect the surgery?
Well, the answer to that is, this is my standard answer now. It depends. It sounds like the operation is not for diabetic retinopathy. It sounds like it's for something else, and I'm thinking maybe a macular hole or some other non-diabetic eye condition. The diabetes can affect the surgery in a number of different ways. One is that the retina can be a little bit more delicate. And particularly if you've had previous laser, there can be special considerations. In general, however, though, a retina that's been well taken care of and the diabetic retinopathy is under good control can undergo an operation and do very, very well. We take all eye surgery very seriously. Obviously, the eye is a very, very delicate organ. And with any operation, there are risks. And as you know, anytime you're diabetic, we worry more about you, and we take extra precautions. But in general, you should expect to do very well with that operation, I would think.
Thank you. Now we have another question about surgery, and this is coming from Davin from Milwaukee, Wisconsin.
Thank you for taking my call. I recently was diagnosed as a diabetic back in April. And just a few years ago, I had bilateral cataract surgery done a week apart just before Christmas, which was awesome. My vision was perfect after that. But now I'm noticing that even though I saw my eye doctor back maybe about 3-4 weeks before I was actually diagnosed with diabetes, that my eyesight is now getting cloudy again, and I'm wondering if I should make an appointment to go see him. Maybe the lenses are getting cloudy again. I don't know. Can you help me with that?
Yes. There are a number of different things that could be going on here. By far the most common would be that you're getting some clouding of the posterior capsule. When they do modern cataract surgery, they leave the clear posterior capsule of your original lens in place, and they use that as a platform to put the intraocular lens on. The intraocular lens is the man-made lens that replaces the lens that you had in the eye that became cloudy and turned into a cataract and had to be removed. So they remove all of it except for that clear posterior capsule. That capsule can cloud up, and that happens up to 50% of the time. So if it clouds up, to the patient, it seems like they've got the cataract coming back, and that kind of sounds like what you're describing. So that, if that's the case, that's easily treatable with a very minor laser procedure that is done as an outpatient in the office, and your doctor could answer that question very rapidly for you, and also allay your fears about some worse possibility, maybe due to your diabetes. That could all be straightened out. I suspect, however, that it's a very minor, very common thing where the posterior capsule has become opacified.
Thank you. So we are now going to go to Ann from Blair, Nebraska. Ann, you're on the line.
Hi. I had an eye stroke in 30 years ago. And the reason I'm calling, I just wanted to see if you've ever heard of that. And when it happened, I couldn't see. And I called the eye doctor. My daughter called the eye doctor and said, "Get me there now." And I have no peripheral vision, and they say I have to use these drops, and I have used glaucoma drops for 30 years. And they say, well, my mom had glaucoma, and that I could get glaucoma, and that would worsen my eyesight. I do have straightforward eyesight, but it was very scary. And now I am a diabetic, and I'm just worried about it getting worse. And I go to the eye doctor twice a year, and so far, as long as I use the drops, I'm okay. And the hole in my heart has been closed with the clamshell. The doctor uses that, I guess, when the babies are little, and or babies, and I was an adult, and at the time they only had 200 people that had that done. I don't know if you've ever heard of it, and I'm fine now, but I just see straightforward. Is there any devices?
Well, thanks so much. That is a very rare thing that happened to you. We actually had a well-known broadcaster, media personality here in Philadelphia who was young, who had the same thing happen to him that you just described. He developed a embolus to a blood vessel in his retina, a stroke to the retina, and we were able to identify a hole in his heart, which he had lived with and didn't know that he had, and that's where the little clot had come from. And they closed it with a non-invasive procedure. It is amazing, isn't it? I didn't realize they called it a clamshell, but yes, they can put this little device in that has a leaflet on each side of the wall and closes off the hole in the heart. And I can see how clamshell would describe it perfectly. Sounds like you had one of the earlier operations with that. He had a later one, but that's a very rare thing. That's a case where the ophthalmologist can actually save your life, because you can be prevented from having a clot go to the brain and kill you, or have a really serious stroke. So I'm so sorry you had that, but luckily it sounds like it was very well taken care of. Risks for that, and any type of vascular event, one always looks for diabetes and high blood pressure and tries to keep that under control. And then glaucoma, particularly if it's in your family, is something that you do need to stay on top of. And it sounds like they're watching you very carefully for that. I don't know if you want to get another opinion about it if you're worried, but if your vision's been stable, I think that's great. In terms of strategies for working around a peripheral visual field defect, that is where the low vision centers and the visual rehabilitation folks can be helpful, because there are some assistive devices, particularly for driving and navigating, that can be helpful for people who have visual field defects, or indeed any type of low vision situation. But congratulations! It sounds like you survived quite a difficult and rare disorder, and have done very well with. Just shows why research is so important, and how new treatments can really make life-saving differences.
Thank you. We have a question, and it's kind of our final question, I think, for today, due to time constraint. Lots of good questions remain. Cheryl Ann from Boyceville.
Yes, I'm Cheryl Ann Reifenberg, and I have had diabetes 2 for over 16 years now. There has been bleeding in the eyes. I'm wondering how stress and all other things could affect your vision, especially with smoke, cigarette smoke or trauma, maybe trauma threat, continual stress
for over 9 years, almost 9 years, how that could affect your vision and why they would have to correct your lenses when you go for your eye test. They would have to make the bifocal stronger in your glasses. And what kind of thing can help to so that I don't lose all of my vision in my left or right eye?
So several different questions there. One was, what other things can affect the health of your eye? And I'm so glad you brought up smoking, because smoking is a huge, huge factor for eye disease. It's one of the big risk factors for cataract progression. And, of course, it has terrible effects on blood vessels all over our bodies. And as we've previously discussed, anything that is bad, well, anything is good for your heart is good for your eye. Anything that's bad for your heart is also bad for your eye. So smoking, of course, is terrible for heart disease. And it's also an additive bad factor for diabetic eye disease and causes serious issues. It's also a risk factor for glaucoma. Other things that impact your eyes include high blood pressure. So I always ask patients every time I see them, how's your hemoglobin A1C? How's your diabetic control? Number one. Number two, how's your diabetes? How's your high blood pressure? How's your hypertensive control? What's your blood pressure? Number three, I ask about cholesterol. You know, what's your lipid profile? How's that doing? And then hopefully I've talked most of my patients out of smoking by now, but if not, we discuss that more because that has high impact. Stress, you ask about stress. Stress affects a lot of things, and I think all of us are feeling the impact in the last year and a half of stress on our mental health as well as our physical health. And I also think if you've been in practice as long as I have, you know that mental health really impacts physical health. So keeping ourselves calm, looking at mindfulness and exercise and stress relief, very, very important for health in general and also for optimizing vision. In terms of why you need stronger bifocals, it's because you're getting older, and as you get older, the eye can focus up close less and less on its own. It needs more and more help. This is for people who are not naturally nearsighted, but for those who have glasses for distance, as you wear your distance glasses, you need stronger and stronger bifocals as you get older. And if you've got any degree of diabetic retinopathy, you may need stronger bifocals to read because there may be some damage to the retina, and you may need magnification in order to see small words. And hopefully, between the glasses and the injections for the bleeding, and good medical control, you will not lose any more vision in your left or right eye. I would encourage you to get a second opinion if you feel like you are and you're not getting a good explanation for why. Thank you.
Great. And I do have one quick answer, but could you give us some pinpoint ideas of what are the symptoms of retinopathy?
Sure. Well, first of all, as we talked about earlier, diabetic retinopathy can be entirely asymptomatic, so you may have it and not know it. So it's important to get the dilated eye exam. But other symptoms that can occur include seeing little black spots and lines that are due to blood floating around, bleeding in the eye that's floating around. Blurry vision is also a sign of diabetic macular edema, which is the number one cause of visual loss in working-aged Americans. So if you have a swollen central part of your retina, diabetic macular edema, you won't be able to focus up close, and the central part of your vision will be blurred. And that is entirely treatable, but you do need to be evaluated and seen so that diagnosis can be made and can be treated.
Thank you so much.
Welcome.
So this wraps up our session for today. For more information on eye health, visit eyehealth.diabetes.org. I know we all wish we could just take Dr. Howler home with us because she has such a wealth of information. A few items before we close. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your feedback. To help you feel confident about your ability to prevent and treat diabetes-related eye disease, we encourage you and your loved ones to talk to your healthcare provider about your risk. Schedule for sure an annual dilated eye exam, whether you have symptoms or not, and register for our next event at diabetes.org/experts. We're sorry we were unable to get to all of your questions during our live Q&A event. If you have questions about this event, you are welcome to contact us at AskADA, that's AskADA at diabetes.org, or by calling 1-800-342-2383. Thriving with diabetes takes a village, and we're here to support you. A very special thanks to our expert, Dr. Howler. I am Carla Cox, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you in our next Ask the Experts events. September 14, health insurance planning, and then October 12, prepping for travel with diabetes. In addition, September 28, why do you need an annual eye exam will be on the Zoom format at 8 p.m. Eastern Time. Register at diabetes.org/experts. I'll turn it over to the survey portion to close out our program. Best wishes for good health.
Thank you again for joining us today. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. For participants online, please click the poll section below the Ask the Questions form and click to submit your responses. Okay, here's our first question. Overall, how satisfied were you with today's event? Prevent sight loss. What is in your toolbox? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. Press 1 for not at all satisfied. Press 2 for somewhat dissatisfied. Press 3 for neither satisfied or dissatisfied. Press 4 for somewhat satisfied. And press 5 for very satisfied. Again, overall, how satisfied were you with today's event? Prevent sight loss. What is in your toolbox? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. Press 1 for not at all satisfied. Press 2 for somewhat dissatisfied. Press 3 for neither satisfied or dissatisfied. Press 4 for somewhat satisfied. And press 5 for very satisfied. While we take a moment for the next question to come up, we would like to let you know about our website dedicated to resources related to diabetes and eye health. You can find more information and answers to your questions at eyehealth.diabetes.org. Again, that's eyehealth.diabetes.org. Okay, on to our next question. How frequently should a person with diabetes get a dilated eye exam? Press 1 for every 6 months. Press 2 for every 1 to 2 years. Press 3 for every 5 years. Press 4 for only when vision is affected. And press 5 for I don't know. Again, how frequently should a person with diabetes get a dilated eye exam? Press 1 for every 6 months. Press 2 for every 1 to 2 years. Press 3 for every 5 years. Press 4 for only when vision is affected. And press 5 for I don't know. Before we go on to question 3, remember that our next Ask the Experts Q&A event will be on August 10th at 2 p.m. Eastern Time. Our guest expert will give you tips on how to best utilize your entire healthcare team to help manage your diabetes. To register, go to diabetes.org/experts or contact 1-800-DIABETES. That's 1-800-342-2383. Here's question 3. True or false? Diabetes-related eye diseases can have no visual signs or symptoms. Press 1 for true, press 2 for false, press 3 for I don't know. And again, this is true or false. Diabetes-related eye diseases can have no visual signs or symptoms. Press 1 for true, press 2 for false, press 3 for I don't know. While we take a moment for the next question to come up, I would like to let you know that if you missed a part of today's event or would just like to listen again, we have full recordings available on the website, diabetes.org/expert. Click on the July 27th event page under past recordings, find the link to get the full recording of this event. Okay, question number 4. As a result of the event, to what extent do you feel confident that you can reduce your risk for diabetes-related eye disease? Press 1 for not confident, press 2 for somewhat confident, and press 3 for very confident. And again, as a result of the event, to what extent do you feel confident that you can reduce your risk for diabetes-related eye disease? Press 1 for not confident, press 2 for somewhat confident, and press 3 for very confident. While we wait for the last question, I'd like to mention that for additional information on managing our diabetes, you can enroll at the ADA-recognized Diabetes Self-Management Education Program. This program will help you gain the knowledge, skills, and confidence to thrive with diabetes. You can find a link to the program near you on our website, diabetes.org/expert, or you can ask a member of our call center at 1-800-DIABETES. Okay, here's our final question. As a result of this event, how likely are you to have a regularly scheduled eye exam in which your pupils are dilated? Press 1 for not likely, press 2 for somewhat likely, press 3 for very likely. And one more time, as a result of this event, how likely are you to have a regularly scheduled eye exam in which your pupils are dilated? Press 1 for not likely, press 2 for somewhat likely, press 3 for very likely. Thank you for staying with us and providing your feedback on today's event. We offer many thanks to today's expert, Dr. Howler, as well as our support vendors and visionary partners in the Focus on Diabetes initiative. This concludes today's program in the Ask the Experts Q&A series. Stay well.